There are three types of nonviolent restraints that we use commonly on our unit. First, the soft wrist restraint. Second, the roll belt. And third, the mitt restraint. First, we will talk about how to apply the soft wrist restraint. Put on the wrist restraint, Velcro, and then tie this through. Make sure you can fit 2 fingers in there so the patient doesn't cut off their circulation, and then you will go down here to tie it. So you put it around a side of the bed that is not movable. Then you go around and loop it through. Pull it tight, and then patient, try to get out. Good job. And then can you demonstrate the quick release? Good. This is Rachel, our patient in a bariatric roll belt. Rachel, are you able to self-release from the roll belt?
I don't know what you're talking about.
So she's not able to, so this is considered a restraint. In order to put it on the patient, you just Velcro them in and then snap right here. There you go. Perfect. And then the bariatric roll belts has these clasps instead of the quick release. If your patient is not bariatric, then you will have quick release ties. Make sure these do not go all the way under the bed. They stay on the outside so that you don't have any trouble with the bed alarm. Rachel, show us how much movement you have in these belts.
Hello? That's about it.
Yeah, so make sure you keep the bed alarm with these patients and keep it in the lowest setting. Call, bow, and reach. All the fall precautions. These are mitt restraints. Slide them in. Velcro around. Super simple. Make sure you can fit 2 fingers in. And then this Velcro also goes on the top so that we're able to release their fingers and let them breathe. If they were on the bottom, then the patient would be able to slip through the restraint. So this is more for like the confused old lady pulling off her oxygen, pulling at her IVs, and it is considered a restraint. So why would we use nonviolent restraints? This is for a patient pulling at tubes and lines, pulling at dressings, attempting to climb out of bed, a high risk for falls with a bed alarm in place. The provider will order restraints nonviolent with a reason for restraint use and discontinuation criteria within the process instructions of the order. The nonviolent restraint order is current for 72 hours or 3 days. PRN orders are never acceptable. Get a new order if the patient is released and put back in, except for brief release for care purposes. Document type, location of restraints, when initiated, chart start. With each new order, chart continued, and when restraints are discontinued, chart discontinued. Document order status with each new order in every shift. Also, document low-level interventions attempted with each new order, order renewal, and every shift. Observe the patient every 15 minutes, but make sure to document at least every 2 hours while the patient is in restraints. Documenting Q2 hour range of motion that it is performed is equivalent to a relief period. Make sure you also document education completed at initiation of restraints and PRN.